once you have made the diagnosis, maybe I'll ask you, Dr. Nagala, what does it mean for the patient and what does it mean for the patient's family? Is it a conversation now with the patient about this is your diagnosis, let's start talking a treatment plan? Do you bring family members in for cascade screening or not? What are the implications of this diagnosis?
It's an emotional thing because they've been passed around for years, sometimes months to years, with saying you don't have anything or this is something imaginary, like the pain is not real. Gives them a sense of relief, but now starts the new thing. Now they have a diagnosis which they carry for the rest of their life, and definitely establishing a genetic diagnosis for them is useful. And then trying to help screen the family members, like just so that they know that if they have abdominal pain in the future, or if they have a neurological symptom or sign, that it could be related to an underlying porphyria attack.
Once you've confirmed an index case in that family, there's a 50% chance that all first-degree relatives would also carry the mutation. Not all of them will have symptoms.
I have that initial appointment. I commonly like to get medical genetics involved. To sometimes help with confirming the genetic mutation, if that's not already known. But I find the other very valuable piece of the information is then going and working with the family about what does this mean not only to the individual, but those loved ones around them, and what can those individuals do to hopefully prevent this from happening if they have the genetic mutation, or educate other family members around to hopefully prevent it or become more aware of it.
If we make the diagnosis early, if we do the mutation screening in the family and educate their family members how to prevent attack, we improve prognosis dramatically.
I do actually screen all patients with the genetic diagnosis of all genetic carriers of acute hepatic porphyria mutations for PBG and ALA. We're finding that in what we would call asymptomatic family members, relatives of an index case. So if we have a patient who has symptomatic acute porphyria and then we screen their family members, and of the family members who have carried the same genetic mutation, who've never experienced the symptoms of an acute porphyria attack, there's actually a significant percentage of them who may have chronic, more subacute symptoms, and most often those people also have elevations of PBG and ALA at baseline. Even if they're asymptomatic, we would follow them and monitor them because we think that they may be at higher risk for developing these other chronic organ damage as well.